Fetal infection is our topic today. Okay, we will discuss the different scenarios, and on the basis of the clinical features we will try to find out the type of fetal infection. Like a fetus, like a baby has intracranial calcification, hydrocephalus and chorioretinitis. Most of these are found on ultrasound as well. If we find these features that point towards toxoplasmosis. Now, if we find on ultrasound that there is fetal hydrops, and if we do middle cerebral artery, we find the signs of the fetal anemia, then most likely the baby will have parvovirus infection. Parvovirus B12 infection can cause these symptoms. Now, if there is fetal growth restriction, we check on ultrasound the growth parameters, these are restricted. We find fetal hydrops along with skin edema and ascites, and sometimes there is stillbirth as well. Okay, sometimes there is risk of preterm birth as well. And if a baby is born without stillbirth or preterm birth, the baby might have deafness, neurological impairment, or bone deformities. So all these features point toward the syphilis. Okay. Now, if we find that a newborn baby is having skin scarring, there are eye defects like microphthalmia, chorioretinitis, cataract, hypoplasia of the limb, certain neurological abnormalities like microcephaly, cortical abnormalities, and mental retardations. So these are the features of fetal varicella syndrome, FVS. Now, in a newborn, we find microcephaly, PD, and cataract. If we have triad of these symptoms in a newborn, okay, we have patent ductus arteriosus, and we have pulmonary stenosis. So these things indicate rubella. Now, if a baby is fetus having IUGR, microcephaly, and cerebral atrophy, ventriculomegaly, intracranial calcifications, and fetal hydrops. So what do these indicate? The cytomegalovirus infection. Okay, we have microcephaly and cytomegalovirus, cerebral atrophy in cytomegalovirus, IUGR and fetal hydrops found on ultrasound, ventriculomegaly as evident here, intracranial calcification. So all these are features of congenital cytomegalovirus infection. Now, exam MCQs. Okay, a nurse works in a daycare nursery and she is 28 weeks pregnant and comes for antenatal checkup. Scan shows hydrops, fetalis, intracranial calcification, microcephaly, and polyhydramnios. Diagnosis of choice would be rubella, cytomegalovirus, toxoplasmosis, and cardiac anomalies or chromosomal abnormalities. The likely cause would that be cytomegalovirus infection. Another MCQ, which infection does not cross the placenta? We have different options like TB, like syphilis, like cytomegalovirus infection, like rubella, toxoplasmosis. So which one doesn't cross the placenta? The answer is that of tuberculosis. So that